Well, welcome everyone, and thank you for coming to Understanding Strokes. Did you know that 2 million brain cells die every minute during a stroke, increasing the risk of permanent brain damage, disability, and death? So what is a stroke? A stroke that occurs because blood flow to the brain is blocked is called an ischemic stroke, and we're going to cover both of these in a minute. The brain cannot get any oxygen and nutrients from the blood, and without oxygen and nutrients, brain cells begin to die within minutes. A stroke that occurs because sudden bleeding in the brain is called a hemorrhagic stroke. The leaked blood results in pressure on brain cells, damaging them. Just under 90% of strokes involve blocked blood vessels, ischemic strokes, and the rest involve internal bleeding or hemorrhagic strokes. Strokes are further classified based on where in the brain the blockage or the bleeding occurs. A stroke is a medical emergency, and a stroke can cause lasting brain damage, long-term disability, or even death. Signs of a stroke can range from mild weakness to paralysis or numbness on one side of the face or body. Other signs may include a sudden and severe headache, sudden weakness, trouble seeing, and trouble speaking or understanding speech. If you think you or someone else may be having a stroke, you need to initiate that call to 911 immediately. Don't drive to the hospital or let someone else drive you. Call an ambulance so that medical personnel can begin life-saving treatment on the way to the emergency room, because during a stroke, every minute counts. At the hospital, a stroke team will assess your condition and treat your stroke with medicine. So stroke can happen to anyone. It's the leading cause of death for Americans, even if you're young, and it can cause serious life-changing disruption. Getting to the hospital quickly saves lives. The stroke rate is rising in young adults under 49. The sooner you start taking action to prevent stroke, the better. In the United States in 2022, 1 in 6 deaths, that's 17.5 deaths from cardiovascular disease, was due to stroke. The death rate for stroke increased from 41.1 per 100,000. In 2021, it went to 39.5 per 100,000 in 2022. So I may have said that wrong, but let me say that again. In 2021, it was 41.1 per 100,000. And in 2022, it was 39.5 per 100,000. Every 40 seconds, someone in the United States has a stroke. Every 3 minutes and every 11 seconds, someone dies of a stroke in this country. Every year, more than 995 people in the United States have a stroke. About 610,000 of these are first or new strokes. And about 185,000 strokes, nearly 1 in 4, are in people who have had previous strokes. Stroke-related costs in the United States came to nearly $57 billion between 2019 and 2020. Costs included the cost of healthcare services, medications to treat the stroke, and missed days of work. And the leading cause of serious long-term disability is a stroke. Stroke, we know, reduces mobility in more than half of stroke survivors age 65 and over. Nearly half of adults have hypertension. That is 119.9 million in the United States. And about 1 in 4 adults with hypertension have their hypertension under control. but the others do not. And we know that is one of the highest risk factors for strokes. Strokes severely change lives. They can cause paralysis or movement problems, including trouble walking or standing and trouble balancing. Sensory disturbances, including loss of the ability to feel or touch or pain or temperature, incontinence, and chronic pain. People often don't think of the chronic pain that stroke causes, but if you have a stroke on your right-hand side and your arm, you're unable to use your arm, that's probably where you're going to exhibit most of that pain. You'll also have problems communicating, difficulty speaking, or understanding language. So it's difficult to communicate. And we are communicators by nature. We have trouble remembering and thinking, including dramatically shortened attention spans and confusion, emotional problems, fear, anxiety, anxious because we don't remember things, fear because we don't know what happened to us exactly, anger because we know that our life has changed, sadness because we know our life has changed, and we see a lot of clinical depression. It is not unusual for people to be quite depressed after their stroke. And about 50%, you have a 50% chance of a reoccurring stroke within the first year of your first stroke. So moving on to the next slide, there's two types of strokes, and we're going to talk about those. The first one is the ischemic stroke, and that's where you throw a thrombus or a blood clot, which blocks the blood flow and the oxygen going to the other parts of the brain, which causes the stroke. And then we have the hemorrhagic stroke, or a hemorrhage in the brain, and that's due to a rupture of a blood vessel. If we look at this, you can see that there's a lot of plaque in that artery. And so we're looking at a ischemic stroke on this slide here. So a little bit more about ischemic strokes. When plaque builds up on the inner walls of the arteries, it can lead to a disease called atherosclerosis. Plaque hardens and narrows the arteries, limiting blood flow to tissues and organs. Plaque can build up in any artery in the body, including arteries in the brain and the neck. Carotid artery disease occurs when plaque builds up in the carotid arteries in the neck that supply blood to the brain. That is a very common cause of an ischemic stroke. You can see in the carotid artery right here, you've got that emboli or their blood clot occluding. Plaque in an artery can also break open. Blood platelets stick to the site of the plaque injury and clump together to form clots. These clots can partly or fully block the artery. Blood clots leading to stroke can happen when there are other heart and blood conditions, such as atrial fibrillation and sickle cell disease. So we know with atrial fib, we're getting, there's more social media about this. We know more what to do with that. And if we can prevent the atrial fib, that's going to reduce the amount of strokes that we see, and it has. MRI studies show that as many as 40% of children with sickle cell disease have a stroke, even though a medical exam does not show signs of a stroke. And again, that's because that clotting in the artery. The only treatment for these undetected strokes, also called silent infarcts, is to receive regular blood transfusions, and that's for the sickle cell person. Studies have found ischemic stroke in people who had COVID-19. However, it's still too early to tell whether COVID-19 caused the stroke. So they're still looking at which came first, the chicken or the egg on that one. But we did see an increase in strokes during COVID-19 for sure. And maybe that has to do with some of the risk factors, maybe because people couldn't get to the doctor for various reasons. They weren't being monitored. Their blood pressure wasn't being monitored. And, they were eating bad. There's a lot of risk factors. So again, we don't know. They're still doing research on that, hopefully. All right, not all symptoms occur with every stroke, and sometimes they go away and they return. Some patients experience symptoms that clear up within only a few minutes, which may be a sign of what is called a transient ischemic attack, or a TIA. This is known to be one of the early warning signs of a stroke is a TIA. If you've had a TIA, you really need to be speaking to a doctor, be seeing a doctor and get worked up, because that's like a precursor to a stroke. You may experience sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking, trouble seeing in one or both of your eyes, trouble walking, sudden dizziness, loss of balance or coordination, sudden severe headache with no known cause, and the effects of an acute ischemic stroke may cause additional symptoms in women, including face, arm, and leg pain. Also, you'll see hiccups or nausea, chest pain or palpitations, and shortness of breath. These are all more significant in women. Someone that I worked for many years ago was out to dinner with her friend, and she picked up her coffee cup at the end of dinner, and it dropped out of her hand, and she couldn't pick it back up. So two nurses at dinner knew the right thing to do was to call 911, and she had a TIA, trans ischemic stroke. So they worked her up and possibly prevented a stroke that would have taken more of her mobility, her cognition, and her speech. So what's the treatment for ischemic strokes? Oops, I always think the treatment for the ischemic strokes, they can be treated with a medication called TPA. TPA dissolves blood clots, obstructing blood flow to the brain. So TPA is what they call the clot buster. This is really important. The window of opportunity to start treatment with TPA is 4.5 hours. So patients need to get to the hospital quickly to be evaluated and receive treatment. Now, they're not going to automatically give you TPA because you don't want to give TPA for a different kind of stroke. You want to make sure that you're getting TPA to get rid of that blood clot. You wouldn't want to give it when they're having a hemorrhage. So, the first thing they're going to do besides doing a physical assessment is they're going to get in to do a CAT scan and look to see what type of a stroke you're having. So you got to figure that in the 4.5 hours. So it's very important that you get to the hospital immediately. There was a 5-year study by the National Institute of Health, and that found that some stroke patients who received TPA within 3 hours of the start of their stroke symptoms were at least 30% more likely to recover with little or no disability after 3 months. So you may see some residual symptoms, but after 3 months, those symptoms go away and that person will recover fully. There are 3 types of ischemic strokes. There is a thrombotic stroke, which is caused by blood clots or a thrombus in an artery. An embolic stroke occurs when a clot is formed elsewhere, usually in the heart or the neck arteries, and travels in the bloodstream and clogs a blood vessel in or leading to the brain. And then the systemic hypoperfusion, which is low. Hypo is always low. So systemic hypoperfusion, perfusion is the moving of the blood, and is caused by circulatory failure of the heart. So that's another reason you can have a stroke. So we talked a little about a TIA. It's caused by a blockage to the brain. With a TIA, the blockage breaks up before there's any damage to your brain, and duration is usually less than an hour. It lasts less than 1 hour, but can come and go. Ultimately, can be a full stroke. A TIA is also called a mini stroke. I witnessed my mom having one. I was sitting there talking to her. She was in her kind of the middle, towards the middle end, or towards the end of middle stage dementia. She had a DNA. She had nothing. She didn't want anything that would save her life. And I was talking to her one day, and she just stopped talking and she stared straight ahead. And then about a minute later, she just continued talking. I'm pretty sure that was a TIA that she was experiencing. But if you're diagnosed with TIA in the emergency room, you go to the emergency room and then follow up with your primary. About 10% of strokes occur after incidents, TIAs. And so, again, it's really important to seek treatment. And again, it may only last a few minutes, but symptoms can also include, and I know we talked about some of them, but on something like this, you want to repeat it so we recognize it. Weakness, paralysis, numbness on one side of the body, especially the leg, arm, or face, impaired vision, impaired speech, poor coordination, or loss of balance. Our next big stroke then is called a hemorrhagic stroke. And that's a stroke that occurs when a blood vessel ruptures within the brain. About 15 to 20% of strokes are hemorrhagic, and there are two kinds of those strokes due to ruptured blood vessels. And it's really named for the relationship. So the first one is intercranial, and that's bleeding within the skull, and the bleeding between the brain and the membrane that surrounds it, the subarachnoid hemorrhage, and then the intracranial hemorrhage. And the intracranial hemorrhage is due to ruptured blood vessels in the deep tissue of the brain. The main causes are chronically high blood pressure and aging blood vessels. Also, there's a condition called AVM, and that's an arteriovenous malformation. Those are congenital malformation of blood vessels in the brain, which can rupture into brain tissue as they get older. And they're usually towards the back of the brain. Really, your survival rate between an ischemic stroke and a hemorrhagic stroke, you're going to see a significantly better outcome with an ischemic stroke than you would see with a hemorrhagic stroke. There's not anything that we can do, medically with medicine like we can with the TPA to correct that. They actually will have to go in and correct that surgically. And that can be very, very risky depending on where in the brain that is. Now, symptoms of a hemorrhagic stroke usually appear suddenly, and they often include a severe headache. They call that a thunderstruck headache or a thunderclap headache. So it's instant, it's painful, it's excruciating, and then right after that, you'll get light sensitivity, dizzy, vomiting, partial or total loss of consciousness. Before that, you'll see slurred or garbled speech. You may see paralysis on one side, loss of senses such as vision, hearing, or smell, nausea and vomiting. You may get neck stiffness, and again, lose consciousness. With any kind of the strokes that I've already talked about, the hemorrhagic or the ischemic, you may not have all of these symptoms. You may have one or two of these symptoms. It's still important to go get it checked out. Very, very important. Here's our treatment for a hemorrhagic stroke. And again, remember, it's caused by a blood vessel that breaks and bleeds into the brain. Doctors must find the source of the blood leak and stop or control it, because these types of strokes get worse with medication that we use for the ischemic stroke. It's important to determine that type of stroke that we're dealing with. So again, you're going to have a workup, probably a CT scan, to see whether it's bleeding or it's blood clot. It's important to treat the underlying condition to stop the bleeding. It's important that we help reduce the swelling and that fluid buildup that's going to occur, remove that excess blood from the brain, and avoid a reoccurrence. The problem with this type of stroke and many others is that you start to get swelling in the brain, and that swelling in the brain can cause a lot of other damage. So it's important that we keep that swelling down. That's why we're going to elevate your bed, HOB is head of bed, to 30 degrees. So we're going to have you sitting up. You're not going to be laying flat. There's probably going to be a monitor inserted in the brain to monitor the swelling. And there's probably going to be a catheter in the brain to pull out all the extra fluid. They're going to actually have some type of control or a monitoring to control the blood pressure. And again, we're going to have to open up that brain, do a craniotomy to control or stop the bleeding. So it's critical right after stroke and in the weeks and months of rehabilitation that we keep that swelling down. And in some people, the blood is primarily in the fluid-filled ventricles of the brain, but the clots frequently block the flow of that cerebral spinal fluid, leading to hydrocephalus or, fluid on the brain. So we have to manage that hydrocephalus often by inserting what we call a shunt in the brain to drain the fluids and relieve that pressure. You've really got to work on getting that pressure down. One surgical procedure for treatment of a brain aneurysm, which is another way to look at it, is a technique called clipping. And clipping involves an operation during which an experienced brain surgeon, you don't want one that just plays one on TV, that's for sure, places a tiny clip or a clamp on the neck of the aneurysm, like on the neck of a balloon, think of it that way, to prevent it from bursting. This is often to ensure that the aneurysm stops bleeding and permanently can prevent any more subsequent bleeding. So how do we diagnose a stroke? And treating a stroke. Treating a stroke can cause, like I said, permanent damage in minutes. So again, repeating myself because it's important, you've got to call 911 immediately. Do not take yourself to the hospital. Do not have a family member take you. They can start working you up in the ambulance. They are in constant communication with the hospital, and they can have that TPA ready before you get there. So treatment following a stroke generally falls into three large approaches. The first one is emergency medical or surgical care immediately after a stroke to minimize the extent of injury. Then we want to treat to prevent a recurrent stroke. And so the medication that we may give you, the antibiotics you may get if we had to open up the brain, anything that will keep you in a state of better health is what is going to be necessary. And then our last stage would be rehabilitation to manage the abilities and the functions that you have after the stroke. Keep in mind that remarkable progress has been made in acute stroke therapy, especially with stenting and devices for clot removal to restore blood flow to the brain arteries. And broadly speaking, treatment for ischemic stroke, or a TIA, may include medicine and medical procedures. Treatment for hemorrhagic stroke involves finding and controlling the cause of that bleeding. Doctors use several tools to help diagnose strokes quickly and accurately. When a person is suspected of having a stroke, they'll carry out detailed assessment of that person's signs and symptoms. They will also ask when the symptoms began. Because of the importance of early treatment, assessment might even begin, as I said, in the ambulance. One test that will help doctors judge the severity of the stroke is something that is called the stroke scale, and that was developed through NIH, or National Institute of Disease Services. Other scales that may be used include what we use as nurses, the Glasgow-Coma scale or the modified Rankin scale, and then there's also one called the Barthel Index. Because I'm not an emergency room nurse, I don't know what they used in the emergency room, but I will tell you on the floor, we used what is called the Glasgow scale. These scales can sensitively measure any disabilities that arise from stroke. Image tests will look at the blood vessels in your brain, and they will help determine what type of stroke you had exactly, and where exactly in your brain it happened. And the faster these tests can be done, the better your doctor can diagnose and treat you. There are several imaging tests to diagnose. Those would be a CT, an MRI, a PET scan. And then we're doing blood tests, EKG, and if necessary, a spinal tap. Spinal tap I don't think is done all that often, because sometimes you can really cause problems with the pressure in your brain when you do a spinal tap. So, in my practice, I've always seen CTs and MRIs done. So what's our risk factors? Chronic long-term inflammation contributes to ischemic strokes. Researchers are still trying to understand this fully. Research shows that inflammation can damage the blood vessels and contribute to atherosclerosis. Ischemic stroke can also lead to inflammation that further damages the cells. So just by having a stroke, you're causing inflammation that can further damage those brain cells. Factors that you can control account for about 82 to 90% of all strokes: high blood pressure, obesity, physical activity, or lack of, I should say, activity, a poor diet, and smoking. Other risk factors based on lifestyles, genetic, and environment are age, which is a risk factor. A stroke can occur at any age, but the risk is higher for babies under the age of 1 and for adults as they grow older. Anxiety, depression, and high stress levels, as well as working long hours and not having much contact with friends, families, or others outside the home, may raise your risk for stroke. We have learned so much about isolation during COVID, and actually the changes that it makes in your brain. So it does cause inflammation. So that's why we say limiting your contact. We heard a doctor that spoke at our dementia symposium a couple weeks ago, and he said 200 minutes a week, 200 minutes a week, and that converts to about 3 hours of socialization will help keep your brain healthy. So keep that in mind. Family history and genetics are going to play a role as well. Your risk of having a stroke is higher if a parent or other family member has had a stroke, particularly at a younger age. Certain genes affect your stroke risk, including those that determine your blood type, because they say people with blood type AB, which is not a common blood type, have a higher risk. I don't know if their platelets look any different than ours, which are those, and there are different clotting factors. There are some blood dyscrasias that are genetic, where, and I have a friend who, she recently had a blood clot in her leg. She had knee surgery and experienced a blood clot, but she had blood clots during childbirth, and her brother has had blood clots, and now her daughter is having, and she's in her 40s, is having blood clots in her lungs. So they're working the whole family up now to see what kind of mutation they may have that are causing all these blood clots, because this really is a risk factor for stroke. Other medical conditions such as sleep apnea, kidney disease, migraine, headaches are also factors. And I will tell you, my father died of a stroke, but he had a stroke as he was finishing. He had just completed his chemotherapy for leukemia. And the doctor told us that that's not unusual, that people with leukemia, because their clotting factors are a little off. So, I would imagine some cancers may cause that too. And then drinking too much alcohol, getting too much sleep, sleeping more than 9 hours, and using illegal drugs such as cocaine may also raise your stroke risk. Race and ethnicity is another factor. In the US, stroke occurs more often in Black, Alaska Native, American Indian, and Hispanic adults than white adults. Why is that? they do studies on it. I don't think they've really come to any conclusion, but you may look at their lifestyle, and their lifestyle might be a more risk lifestyle. I'm not sure, but as I tried to process that rationale, they may eat foods that are a higher fat. There may be more smoking. You might see some drug use, but I think social economically really plays a role in it because they're unable to seek adequate health care. And then sex can play a role in risk for a stroke. At younger ages, men are more likely than women to have a stroke, but women tend to live longer, so their lifetime risk of having a stroke is going to be higher. Women who take birth control pills or use hormone replacement therapy are at a higher risk. Women are also at a higher risk during pregnancy and in the weeks after giving birth. High blood pressure during pregnancy, it's what is called preeclampsia, raises the risk of stroke later in life. And then lastly, viral infections or conditions such as lupus, rheumatoid arthritis, and some of your chronic illnesses, your autoimmune illnesses. I do have an autoimmune illness, and it's an inflammatory process. So this is something that I always have to think about and be cautious of, and look at my risk factors and try to modulate those. All right, 1 in 4 people who experienced a stroke are going to experience another stroke. And it's really higher after the first stroke and the first year after that stroke. So working on lifestyle modifications and risk factors may help decrease the chance of having another stroke. Studies indicate that approximately 23 to 25% of individuals who've had a stroke will experience a second stroke. So there's that 1 in 4 that we're looking at. First, let's talk about reducing your risk, because I think they're very important. We got to monitor our blood pressure and take our blood pressure medicine as prescribed. I have a friend that doesn't take his blood pressure medicine on the weekend because he likes to take a medication vacation. Well, that's not how the doctor prescribed it. And yes, a lot of those medications have a half-life, which means there's a duration that it circulates in the body. But medications are given at a certain time and a certain schedule based on what we know the outcomes will be if you take that medicine as prescribed. So you need to take those as prescribed. Get regular exercise, walking, strength training, cardiovascular, whatever you can do, chair yoga, and then eating healthy, increasing your proteins, decreasing your carbs, decreasing your red meats, drinking plenty of fluid, eating green leafy vegetables, cutting out your vegetables that have carbs in them like carrots and peas, and increasing your vegetables that are going to keep you healthy, like cauliflower and broccoli and spinach. See your doctor annually and more if necessary. I'm going to go back to eating healthy a minute. You know that sugar causes inflammation. So sugar in moderation, which is hard for many of us, myself included. Maintaining, so see your doctor for your annual visit and more if necessary. If you're starting to feel that there's changes, we know our bodies best. And so if we feel that there's changes, you need to see your doctor. Look at what your healthy weight should be. Excuse me, I just had a conversation, a weight management doctor the other day, and we were talking about what social media and what it says in books that should be a healthy weight for someone in my age group, and I'm an older adult. But I had always heard that you should be slightly above that, because it helps you. You need that reserve for your body. And she said, if you look at your BMI and your BMI is, I think, I can't remember exactly offhand, but I want to say like 35 to 37 is, a normal, you're getting up to the high normal BMI. If you're slightly over that, statistics show that if you're hospitalized, you have a better outcome than someone who's way below their BMI. So someone who is very, very thin may not have as good an outcome as someone who is just a little bit over what they say your BMI should be for your age and your height. So it's really solidified what I had thought about that. But my job is to stay at my BMI slightly over. Choosing healthy drinks, Diet Cola, one of the worst things that you can drink. It's got a lot of additives. It's got a lot of sugar. So stay away from the high sugar content drinks. Plenty of water, 64 ounces a day, which I know is difficult for most people, and I'm included, for me to choke down. Small sips. If you fill up a big canister, the big canisters that they sell now, get one that you can't see through, because you might get discouraged if you see you've only drank half of that. And sip on it every 5 minutes. Pick it up and take a sip, take a sip, take a sip. There's also apps for watches that will remind you to go ahead and take a sip of water. So that's the best thing that you can drink. What I want to show you is to spot the signs of a stroke. And if you remember the acronym BE FAST, because that's what we want to do, is we want to be fast on calling 911, identifying the symptoms, calling 911, and getting that person to the hospital. So B stands for balance, loss of balance or coordination. And then E is for eyes, changes in vision. F is for face, drooping on one side, not both, on one side of the face. Now, there's other things that can cause drooping, but again, you still have to get it checked out. Arm and leg weakness. You're unable to move that arm effectively. It feels very weak. Difficulty speaking. So there's the S, speech. Understanding others or speaking is the way to think of it. And then time. Call 911 immediately as soon as you have any of these symptoms. So really, our takeaway today is that you need to be to the hospital and call 911 as soon as you can when you have any of the symptoms. They're always going to do an assessment. They need to figure out if it's a hemorrhagic stroke or an ischemic stroke, because we only want to give the TPA with the ischemic stroke. You get best results if it's 3.5 hours to 4 hours after the onset of those initial symptoms. So that's why it's really important for you to access healthcare as quickly as you can. Well, I want to thank you for joining us today. Just be fast if you ever see someone else with any of these symptoms, or you see these symptoms on yourself. Thank you for joining us.